This is really a special day. It's special to all of us. It's very special to me as well because Dr. Walter Holton was my late husband's doctor, who he dearly loved. And if things were going wrong, he said, Tess, I have to call Doc. I know how to call Doc and talk to Doc. So as we all know, Dr. Holton took care of many, many people for many, many years, Dr. Holton. And we're just so proud and excited to be here today. You know, we've all come through a tough couple of years, but the Outer Banks is resilient. We're all strong, and look at where we are today. And I loved it when I pulled in here today and I see all our wonderful staff over here, and they would step out and show what's on your shirt. And that's what we're talking about. That's exactly what we're talking about, and we couldn't do what we do without all of you. We absolutely could not. And it's my pleasure right now to introduce you to our hospital president who never stops, Ronnie Sloan.
Thanks, Tess. So if you don't know, today's a special day because 22 years ago today, Outer Banks Hospital opened its doors. So happy birthday to Outer Banks Hospital. Now, obviously, Outer Banks Health and a lot of growth over those 22 years, and I think this is kind of a birthday present today we're giving you. Going to expand this clinic. Matter of fact, this clinic expanding to about 7,500 square feet. It's going to double the clinic space size. We have 3 providers today here. Dr. Summers, I see you guys hiding in the back. Dr. Summers, Dr. Baker, Dr. Worthen, there you go. So thank you for being here, and the team couldn't do it without the team, Tia and team. Raise your hands there. All right, we're going to clap again because what a fantastic job you guys do here at Manteo Family Medicine. We have been fortunate enough over the last about a year and a half or so to recruit 6 additional providers here for primary care. A couple of 2 of the 3 you just heard about just there, but some providers over at Nags Head East as well. If you have some curiosity about the number of primary care patients that we handle right now in Outer Banks Health System, about 16,000, and 3,600 of those are here, actually Manteo Family Medicine. So a big group of patients for sure. Second largest practice in the Outer Banks, only just slightly behind. I think it's going to grow and beat that one day. Slightly behind the Kitty Hawk Family Medicine practice, currently only by a few hundred patients as well. So also been very fortunate. If you wonder what we're doing in primary care, we've 2 providers right now we're working with. One's had a site visit. I think one will shortly. 2 physicians who also could join our primary care ranks. Primary care is one of those things. As we grow, it has to grow, and we'll never stop recruiting, I don't believe, for primary care providers. Also tried some unique practices as well. The one in Nags Head, for example, is a APP, Advanced Practice Provider Practice, that has a physician and APPs in as well. A little different way to see patients, but today in the environment, you got to do what you have to do to take care of our community. So that's what we're doing as well. Besides doubling the square footage here, we're going from 8 exam rooms to 15, and today we double up some exam rooms. If you don't know, we do telebehavioral health here and over at Nags Head East, and right now those patients are seen in a regular exam room. In this new clinic, we'll have a dedicated behavioral health telehealth room as well, a dedicated wellness office as well. And this is important, especially if you're over here like I am as a patient and you sit in the waiting room long waiting for your labs to be drawn. We're going to have bathrooms in the new waiting rooms. Yeah. So they have to knock on the door and say, can I come in and take a bathroom break? Conference room, some great outdoor space you'll see on the design for the staff to enjoy some relaxation and time during the day to get out and take a break in the sunshine, which is so important. But you know, at the end of the day, man, we couldn't do any of this without this man here. This physician, Dr. Holton, came here in 74, and worked here for 40-something years and then turned over the reins, but had this vision himself, I've seen it on paper, to expand this clinic one day, and had the forethought to purchase a couple lots on the other side so he actually could do that. So now we're pretty much going to take his dream, make it reality, double the ability to take care of Roanoke Island, probably some mainland as well, just growing, and maybe a little South Nags Head, I imagine, as well. So really, really exciting time. And it would, no way could we do this without asking Dr. Holton to say a few words. So I'm going to let him do that right now.
Thank you. First, I want to introduce Barbara. I'm sure all of you know her, but she has a lot to do with my success. And there's nothing that I think there are things that I couldn't have done without her behind me. And I want to give you just a brief, try to keep it brief, history of how all this came to here. And what happened in 1974 is that I was in my residency in Hershey, Pennsylvania. That's where my residency was. And, you know, at that time, we got a call from someone. Actually, that call, I think, came from Keith Fearing, and it had to do with the need for a physician here. There was not a physician in Dare County. And there had been one that had left not long before, but the closest medical care they had was Elizabeth City or Wright's Clinic, if some of you know where that was up in Currituck. And it was a problem. And at the same time, it's very difficult sometimes to go to a place and have your wife agree to go with you when there's no medical care. And when the closest big grocery store was in Elizabeth City. It was different. And we decided together that we would take this on. And I was in my residency and I left that and we showed up here and there was a small clinic on Ananias Dare Street. And it was good, but it was small. They did have a room in there to deliver the babies. And think about that, you know, and we did that. Barbara was my assistant most of the time, particularly the after hours ones. And, you know, we just started to put it together and we fell in love with Dare County. Now at that time, we had family that was coming along. We had 2 children before we came. And we got involved in other things like anyone would. I was doing, my outside interest was in education because of the kids. And you look at that and then you come forward and this building was built. And it has been, I think, the best building in the county, but it needed more. And I was so pleased working with you. And Lynn Miles, over the past few years, she's always been there. And every bit of the staff that's worked in this building, I never disliked anyone. I want you to know that. I mean, they were just great. Everyone put in extra hours, and it just went along. And I had a problem in my 44th year that dealt with a fall and dealt with COVID injection. But all that being said, that caused me to have to leave. I miss it every day. I'd give anything to be back in medicine again, but I know it's not going to happen. I'm in vacation some now. I've learned to try to get along without the medical clinic, but I'm really proud of what these guys are doing. What Lynn tells me about, what he has to do with, and it's just, it's amazing. The boards have been good. I could name all kinds of people, but I think that would be unfair because I'd leave someone out. And I don't want to do that because time that's been put in by people, and now we're talking about getting a building back over here that's going to service this part of the county, and there will be people coming in because they'll love a new building. And it will be very functional because I know who's running it, and I know that they are just devoted to their careers. So I just want to sit here now, and I feel great because I was able to participate in what's going to happen. And I appreciate that, and I thank you for that. So, it won't be long before I think there can be much more done to help those people that really need to be seen and having trouble being seen in Dare County now. And I'll feel better about it when this is finished and running. So anyway, once again, thank you.
Mm-hmm. Well, let's see what you think about the new building. We're gonna pull this off and let you see what your vision turned into. Yeah, so if you need orientation, this is the current building with the entrance here. The new entrance is going to be facing 64. A lot better for accessibility for folks that have physical issues with accessibility as well, which is a big key. But at the end of the day, I don't know how many months from now, I would ask the builders here, but they'll get mad at me because all the delays and issues and supplies, all that kind of stuff. But you know, sometime from now, there's going to be a new building on the back side of the building, and our providers and staff will move into that and operate. I'm already praying for them because it's going to be a tough year and a half or so, I think, with all the move back and forth. Then we'll go back to the front half of the building and restructure it pretty much extensively so it flows really nice with the new building as well. And all the cabinets, all the fixtures, everything matches through the entire building, and then reskin the entire outside of the building so it is indeed looking like one brand new building that essentially it will be at the end of the day. So I hope you like it.